Hi, my name is Glenn, and I have just recently had a slap procedure on my right shoulder. I had it last Wednesday, today is Monday. I wanted to reach out and just sort of tell you my story because it doesn't quite meet what the typical slap repair stories are. Mine is more related to a cyst that was developed because of synovial fluid draining through the labrum tear, and the cyst was impinging my nerve, and the nerve was giving me arm fatigue. So I've done a fair amount of research on YouTube, just hearing people's stories and their recovery process, but I didn't really come across much for my scenario. So I wanted to talk about it and hopefully be able to give a little bit of insight on how I have dealt with it. So we're April 2022 right now, and 15 months ago, I'm quite athletic. I do a lot of cross-country skiing and train quite regularly. So I kind of come to the table with a fair amount of athletic background. And I was training, and I began to have arm fatigue to the point where my right arm, I was actually unable to lift it up. So I went to the chiropractor, and she did her tests and was not 100% sure what the issue might be. Went to my GP. My GP recommended that I go to more of a shoulder expert. These were all great doctors, and to be honest, the process I think went flawlessly from chiropractor to GP to the first shoulder expert. And he put me through a series of tests and noticed that I had some rear deltoid muscle atrophy, which is indicative of labrum tears and bicep attachment tears. But no one could really explain at this point the continual fatigue in my arm. There were days that I would actually have to ski or work out with only one arm, my left arm. So this went on for 2 months, January and February of 2021. So the second doctor did an ultrasound and discovered that I had a cyst. The cyst was about the size of my thumb, so a fairly sizable cyst, 10 centimeters by, I think it was like 3 or 4 centimeters. And it was liquid filled, synovial fluid filled, which was impinging my suprascapular nerve. And because of the impingement, that was causing the fatigue and the lack of strength in my right arm. So we went through a series of tests. I went through all sort of muscular or physical tests, and it turned out that this is called external rotation, thumb down, and you bring your arm out. So both left and right arms, I would do this together. My right arm was drastically reduced in strength compared to my left arm. So the third, this would be my third doctor now. I went from my GP to a shoulder expert, and that shoulder expert then recommended that I see another shoulder expert. And this shoulder expert, we decided that it would be best to drain the cyst. So using ultrasound, he guided a needle in and removed 2 cc's of synovial fluid from the cyst. I got to watch the process on the screen, and it really was fascinating. I could see the needle coming in, and then it entered into the cyst, which on the screen was quite large, and he then drained out 2 cc's of fluid. And he showed me the fluid, and synovial fluid it's like honey. When he drained it out, it dripped very thick, so you can see why it lubricates joints. So why do I have this cyst? And he had done a number of procedures like this, and he said yours is quite odd because I never once had pain. I had discomfort. It was more or less like just like a continual throb and a throb. of shoulder pain, but it was all muscle strength, reduction of muscle strength. So I went then and got an MRI, and the MRI showed, of course, that I had a labrum tear, which I'm 54, been athletic my whole life, with some overhead sports, not really baseball, the typical labrum tear sports, no throwing, but I rock climb, but I do a lot of cross-country skiing, and with skiing you can double pole, and there's a lot of some over shoulder head height activity, and that is probably what caused the tear. But I could have had the tear years. Most people at my age, athletic people of my age, will have tears. It's not abnormal. So now the fluid was drained, and the impingement to my nerve has been reduced, and my arm operation came back. But with the MRI, the positioning of the tear, I could actually see the tear, looking at it with my third doctor. He said this is acting as a one-way flap, and it's allowing synovial fluid to escape from my shoulder into the cyst, to create the cyst and keep it charged, to keep it filled. But it's not allowing the synovial fluid to escape. So this is where the slap procedure idea came up. So then I went to the fourth doctor. He was a surgeon, and he looked at my MRI, and he was very quick to see that the positioning of the flap of skin, the flap of labrum, I'm not actually sure if it was a flap of labrum or if it was the flap of the bicep tendon. I had a flap regardless. It was a 7 millimeter flap, and he was quick to say it's quite obvious that the flap is acting as a one-way. That's why you have this cyst. He suggested surgery. So this would have been last May, and it's so 11 months ago. The cyst was drained. I could train, I could exercise, but I did have continual discomfort. Manageable. I then decided that because of the advice of the surgeon and my third doctor, that the cyst could continue to fill, and you would continually have that impingement of the nerve, to schedule my surgery, to reattach that torn flap. So I had that done last Wednesday. Today's Monday morning. The surgery went well, as far as I know. I was a bit in a daze when the surgeon came to me afterwards, but he said, yep, you had a distinct tear. We've reattached your labrum and also reattached a portion of your bicep tendon. 5 days later, I feel quite good. Obviously, I'm still in a sling. I've changed my bandages. I had 3 arthroscopic access points, and then also I had an incision in my armpit. This is about a 5 centimeter incision in my armpit. I've only put gauze and tape on this one, where these are proper bandages I put on yesterday. No infection, no redness, and to be honest, very little pain. I think I'm quite fortunate with the way this procedure's gone. So I wanted to reach out and just tell you about why I have had my procedure done. And I think that for some of you, the impingement of the nerve it was debilitating, to be honest. I was basically just a one-armed person. I could lift my right arm up, but the impingement caused me to struggle with normal activity. And here I am. I'm glad I've had the procedure. I think my recovery is going quite well. To be honest, I actually slept last night without the sling. And I went for a walk yesterday, went for a walk the day before, and I'm in good shape. I hope this has helped you. I have to come up now with a proper term or a proper title so it will apply to people looking for cyst impingement do I or don't I get the procedure, the slap procedure done. I'm recommending, if your situation is very similar to mine, to get it done. Oh, another point is that the third doctor who did the fluid, who took the fluid out, actually wrote a small article in a medical journal about it. He said that he hadn't come across one like this, especially because I didn't present with normal pain symptoms. I had discomfort, but I didn't have pain. And this type of cyst and the size of the cyst, I just had weakness. And this was the problem this was the issue that was a problem, identifying kind of where this pain, where this muscle fatigue was coming from. So he wrote a short article in a journal about this. So it's a bit of a unique situation, and that's why I felt you would potentially benefit from my story. A couple of things, I'll just give you painkillers. I took 5 oxycodones over the course of the 3 days leading after, and now I'm off pain meds. Lots of fist clenching. It's given me a lot of relief. I've taken 1 Tylenol 3, so 5 pain meds altogether. Now I'm almost 2 days without pain meds, and it's manageable. I got a nerve block. I think it worked. It worked for me. I slept well the first night. It lasted about 24 hours, and the pain, it wasn't over the top when the nerve block subsided, but I'd taken an oxycodone. I put 11 pounds on 24 hours after the surgery with just water retention. It took about a day and a half for it to go. So I went from 172 to 183, and now I'm back down to 172 on the 5th day. So be prepared for muscle retention. I've never had surgery, so the water retention was, I expected it, but it was quite a bit more than I anticipated. Food, my wife's been working, so I've been eating lots of fruit. Yeah, obviously constipation with the oxycodone. Having only take 5, I still had to deal with that. I did take some, this product, Senocot S. I'm from Canada. Anyway, it worked. Lung congestion. I've never been intubated, and I did have some lung congestion, which didn't alarm me, but I was trying to get rid of it. So I did actually search on YouTube post-intubation lung congestion, and came up with some really good information, breathing techniques and coughing techniques. And so I managed to get rid of that. Today's my first day where I haven't really been coughing a lot. So I think that helped. Well, I hope this has helped you, and I feel that the information could be helpful to others. So good luck, and hopefully you don't have to go through what I have, but it worked, and it worked well. Okay, bye.